Happy Monday, everybody. We are on today. We're getting ready to comb some hair. I know I'm starting out with my own hair, but guess what? We're not going to end up with just my hair. I'm going to comb my dog Janice hair. Yeah. So just stay tuned. Grab you something to eat, something to drink, and let's watch me comb Janice hair. Yeah, give me a second to finish up my own, and then we can go into the next room. Let me know what's going on today in your life on a Monday. Earlier today, I had my appointment with my therapist today. God blessed me to get a real psychiatrist, right? I had a counselor from my primary doctor's office, and she worked out just fine. But I wanted somebody that was really, really qualified the way how I felt like I needed somebody to talk to, right? And that just go to show you that it's always somebody worse off than you. Hold on. And I said that because sometimes people who you think are there to help you, sometimes you end up being there to help them. So we kind of like help each other. And we click like that. Yeah. I can honestly say that. We click like that. And I love it because it's nothing new for me. When I was a little girl, I've always been able to talk to people. I've always been able to help people. I've always been trusted by older people. I was a little girl and I was trusted by women that was like in their 40s at that time. And of course, when you little, somebody in their 40s is like an old person, but they were still young, but they was much older than me. I'm talking about I was like 14, 15 years old, and I was able to give advice to older women. Give me a second, y'all. So, I do believe that if you feel like you need somebody to talk to and you don't have nobody that you can trust and you don't want your business, your real business to get out there, because I am an open book, but trust me, some people think I tell all my business on Facebook and all that, but I actually don't. Believe me, I don't. And so if you're like me, if you're an open book, but you still want to protect your privacy, yes, get a professional therapist, and it is okay. You are still normal, okay? What is not normal and what is not okay is to want to have somebody that you can share intimate stuff with, but you're afraid to do it because you're afraid of judging yourself, really, because these people are sworn that they cannot talk about whatever y'all talk about together. So it's privacy, total privacy. Handle your business, okay? Your girl is telling you, handle your business. If nobody ever given you sound advice before, I'll be the first to give it to you. Handle your business. Get you a psychiatrist. Get you a therapist. You can call them an emotional therapist, mental therapist. I don't know. But get you somebody to help you. I am on my way to my bedroom now. and we are going to comb Janet's hair. I still don't have a tripod, and I'm working on getting me a mic as well. I used to have a tripod, but it broke. I moved a couple of times back to back, as you all might remember. So, during that process, I broke my tripod. So, I have to kind of put my phone up against stuff. Hopefully, it won't interfere with the volume and all that. Hopefully, you all will hear me loud and clearly. It's a chance that I'm taking, and I am working on getting me a mic from Best Buy. Somebody told me I can get a reasonable mic from Best Buy. And then I want the kind of mic that I can like clip onto my shirt so I don't have to worry about holding it in my hand while I'm multitasking, right? So let me go ahead and find a good position for this phone and so I can get started with Janet's hair. Grab y'all something to drink. And let's go ahead and get into this video. And this is going to be a fun video. Yeah, it's going to be a fun video. Say hi. Hi. Yeah, I did laundry earlier, so I got stuff that I still need to put away. But I'm taking a little break. With me having my stomach issues and stuff, I have to give my muscles a break in between different chores and stuff I do. Because if I overwork myself, I cause more pain to myself. So I have to kind of work in paces when it comes to shifting my body around. Whew. Yeah. Yep. Hold on. I think I left something in the other room. Okay. I started out discussing my therapist and things like that. So this video, we're going to dive into our mental health in this video, and I'm going to talk about the story of this doll. Um, I think I mentioned earlier that her name is Janice. She is named after my big sister Janice. This doll is supposed to be maybe a Caucasian type of race, but she is my biracial baby because my sister Janice was biracial. So this doll in my family is a black girl. Okay. And as you all know, black people, we have many skin tones, okay? So, yeah, it is very reasonable to call this doll a black girl because we have skin tones of fair complexions, light skin complexions. So, and my sister Janice had very long, naturally silky, wavy hair, just like this doll. We lost her. She was about 60 years old. She died of cancer. Cancer is something that runs in my family, unfortunately, especially among the women. So I have to not only watch out for my mental health, I have to watch out for my physical health, my just my medical health. Period. I have to stay up on. I have to stay on top of my um, I have to see my gynecologist. It's another word I'm trying to think of. Oh, y'all know what I'm talking about. I have to, make sure I keep my appointments and stuff like that. Early detection is the best, right? And a lot of times, we tell ourselves, oh, we're going to be all right. It's not going to happen to me. Well, we do walk by faith, not by sight. But God also gives us common sense. And He also said in His word, my people perish because of lack of knowledge. And that means that there's some things that we don't have to perish about if we take the time out. Oops, Lord, I don't know how that happened, y'all. If we take the time out to take care of ourselves first. Yeah, so as women, we need to see our gynecologist, at least once a year. Go ahead and get that physical exam and do your follow-ups and all that type of stuff. And yeah, it's very important. And sometimes, that leads into our mental health, because sometimes if we don't have enough faith to not worry about this and that and the third, it can become kind of stressful if you allow yourself to worry about the unknown, especially if you're having crazy pains and things like that, things that the doctors can't explain and stuff like that. The devil can easily whisper in our ears and tell us that it's something more serious going on with our bodies, and which is another reason why we should definitely make sure we do our part, and also even take the time out to do research. It doesn't hurt anybody to do your own research. Did I leave my brush, y'all? The other term I was trying to think of is the word pap smear. Yeah, women need to make sure we stay up to date with our yearly pap smears. Yeah. So, getting back to this beautiful doll right here. Look how wonderful her hair is. And it's just as soft and manageable as it looks. Yeah. So, I'm going to style her hair, and then I'm going to uh, change her clothes, or maybe I should at least take off her yellow dress and put on her blue dress before I start on her hair, right? I think I'm going to do that. Sometimes that makes the doll's hair mess up if you do too much before um, taking the clothes off. You do the hair first and then take the clothes off. I don't know. So let's just go ahead and get her out of this dress. She has been wearing this dress for a long time. Notice her undershirt, y'all. The undershirt says Sheila. I actually got this personalized from Temu. This little onesie undershirt from Temu. And I put it on this doll because this doll is, like I said, she represents my sister Janice. So yeah. So I put my personal shirt on her. So yeah, let's get started and have some fun today and have this deep discussion about taking care of our mental health, taking care of our physical health, and mental health also involves our emotional health, okay? And like I said earlier about my own therapist and everything, uh they have problems too, y'all. So yeah, when we go see them, sometimes they feel so comfortable with us, they'll talk about their problems too. And to me, that makes me feel more comfortable, because it kind of help you look at your person as a human being just like you, and you feel less intimidated just because they carry this position, right? You don't feel like you're crazy, you're different, you're weird, you're unusual, or you have a problem that's different. And depending on how deep your situation is, I don't know. Some people might have more unique things going on than others. Um, but you should still feel comfortable with the person that you chose to be your therapist. As a matter of fact, give it, I say, 1 to 2 visits. um if you don't have a good vibe with that person, don't even stick with that person. Don't waste your time, because everybody is not for you. Just because They're therapists just because they have their license to listen to you and to kind of help you sort things out in your mind, in your heart, and everything. It does not mean that person is a good fit for you, because I have been through more than one person before. And I usually, the way how I do things, I don't ghost people. I don't believe in ghosting people. I believe in strong communication. Whether I am appreciated for being the type of person I am or not, because a lot of times I'm not appreciated, especially depending on what setting we're talking about. But in all settings with me, I practice communicating before exiting. If something is not a good fit for me, I'm going to communicate that in the most respectful way possible. I might not always go into full details, because one thing I am learning is people who over explain themselves, we're the very ones that get judged the most harshest, because they people are more intimidated by us, because we explain, and one, they're not used to having people to explain to them the way how some of us are. They're just not used to it. And they have more respect for people who will ghost them than somebody who would just try to talk to them. So I'm going to tell you all from experience, uh you do what you usually do that works for you. I can't change how your personality might be, but find you somebody, a professional that your medical card will cover. And just to let you know, the public aid medical card does cover getting a psychiatrist. However, the waiting list is long. I had to wait a whole year before I had a psychiatrist available for me. Meantime, I was able to get a counselor. So a counselor is somebody on a smaller scale than a psychiatrist. um, I noticed that now that I have a psychiatrist, if I were to make a comparison to how the room setting was, the counselor, and I don't know if all counselor room settings is like this, but this is just my personal experience. It was set up like anybody could have been seeing them, including children. But I see like an adult psychiatrist now. But when I was seeing a counselor, there was an area in that same room was like set aside for children to play. It could have been for somebody who didn't have a babysitter, or it could have been set up for an actual child to get counseling. I don't know. But it's not set up like that with the psychiatrist, especially with the adult part of the uh what I decided to go with. I want specifically a psychiatrist that deal with adults, and that's it. And so in that room, it's more comfortable. It feels like home almost. It it doesn't remind me of a clinic. And it has two comfortable chairs. It has pictures on the walls. Kind of remind me of, at home, you might have some nice little pictures on the walls, some pictures that might have some water, some park, some people, maybe a couple that's walking down the street holding hands. Just something loving, something that you can look at that'll kind of make you imagine something deeper than your immediate settings, how you're feeling. That's kind of something that make you dream a little bit, go down a little memory lane, a pleasant memory that might have happened uh, before in your life, something unforgettable, but something nice. And so that's what the atmosphere feels like in the room of my psychiatry. Um, it feels like something I can relate to, and it feels more personal instead of like anybody, including children, can be in that same atmosphere. And don't get me wrong, for that year, me waiting on my psychiatrist, it worked. Something was better than nothing. So please don't let that stop you from getting the help that you need. What happened? Okay. Don't let that stop you. Do whatever you need to do. Whatever your medical card covers, where you don't have to pay cash money. Um, yeah, because it can get to be very expensive. Now when I was going through counseling, um, that was like 30 minutes a session. But when I crossed over to getting a psychiatrist, that was like 45 minutes to an hour. And depending on who you get, if they like you, and if they really feel like you need them, or you're, how can I say this? I don't want to say you interesting, because they shouldn't judge you based on that. If they really click with you for however reasons why they click with you, and if they don't have somebody else that's right behind you, they will go over their time. They because my psychiatrist have went over her time before. And yeah, so what I'm saying is, do what you need to do to better your mental health. um I have dolls. I collect my dolls for the artistry. I also collect them because I love dolls, and I've always had dolls all my life since I was a child. But I also let people know my dolls are my emotional therapy help as well. Um, I was told by somebody that that's impossible. A dog can't do nothing for you, and that you're right. Dolls don't have no power. I tell people that all the time. Do not make idols out of your dolls. What I mean when I say my dolls are therapeutic for me, like what I'm doing right now, combing her hair, dressing her up. This is therapeutic for me. This is what I mean. It's everything that I do for the doll. In one of my videos, I actually had a doll land on my shoulder. It was one of my sleeping dolls. That was relaxing and therapeutic for me, because when I look in the mirror as I'm holding the doll, and I'm not saying I always look in the mirror, but I'm just saying, when you're looking in the mirror and you see the dog looking peaceful, like a real baby would be peaceful if they would sleep. What do we call those babies when they're sleeping? Oh, she's look like a little angel, right? So I don't know anybody that can compare something to an angel and don't feel some type of peace about that setting, okay, or that feeling. So yeah, that's what I mean. And at this big age I am, age 55, I'm learning to really explain myself less. Now, if it's somebody that's really meaningful in my life, and they have questions about my dolls, I will go into details, because I'm okay. I have nothing to hide. And I'm okay with sharing my story and all that good stuff. I'm okay with that. Now if it's somebody I feel negative vibes, like they're gonna judge me no matter what, I tend to just keep my explanations to myself. I might state however I state, and I'm always respectful. So I'm not somebody that just snap off on people, but I will uh, do less explaining if I get negative vibes that this person really is just trying to get more information to troll me in one way or another. Um, yeah. So yeah, I just want you all to always keep in mind that what you do, whatever you do, just make sure that you guard your heart. Make sure that now some people might say, I don't believe in God anyway. Well, for people who really don't believe in God, then I can't say too much to you about guarding your heart and not making idols out of your dolls. That's between God and you, how you handle things. But I'm talking to other people who do believe in God, and who do fear God. That's who I'm talking to. I'm talking to you. We want to make sure that we're not making idols out of our dolls. And so we want to make sure that we're keeping God first in our lives. We're seeking Him for guidance. We seeking Him for healing. The baby dolls, whether what other medium the doll is made of, it has no power. It can't do nothing. It's what we do for the doll that benefits how we feel as a consequence as having a doll. Okay, it's all in our control. Okay, it's not no control of the doll at all. Yeah, so with me saying that, I can continue with what I want to say. uh this is my channel, this is my content for today. So yeah, please don't get upset if you disagree with me, because this is how I feel. This is where I'm coming from. And since I'm the one talking, for people who might be first time coming through my channel, I want them to understand where I stand. You know, when they come across my channel and they see this full grown woman with a baby doll, I want them to understand that much. You know, they don't have to approve my baby doll, but I do want them to kind of have some type of context about my doll, right? About my dolls, because I do have dolls, DOLLS. I have more than just baby Janice here. So yeah, I'm gonna put this vintage dress on her. It's like I don't know what you call it when it's like two dresses in one. You put the I'm sure it's a term for it, but we're gonna put the blue dress on first and then put the top layer of the dress on top of that. Anybody in the comments know what that's called with these vintage dresses? Please help yourself and let me know. Let your girl know in the comments. So we're gonna put this beautiful underlayer dress. It's beautiful, a pretty pale blue. And I just got my nails done a couple of days ago. And I don't get my nails very long, but sometimes these buttons can be difficult, when you have, nails. Even though they're not real long, they still interfere with buttons. So y'all bear with me. If I take too long, I'll just pause the video and just go ahead and handle my business. Uh, I'm going to start doing lives, but here's the problem with lives. I need to be a better planner. I'm very spontaneous, so that kind of go against somebody who wants to do lives, because I want you all to be aware of it so that you all could be able to plan for my lives. What I do like about the lives, though, my algorithm does really good with lives, and I usually get new subscribers. And but the problem is my old subscribers, you all don't always get the notification of lives, or y'all not able to attend the live. So I'm usually talking to a bunch of new people, and some of them don't have no clue what's going on. Others, they're like kind of open-minded. Like I said, I'm the type of person, I can talk to anybody on any level. I have no problem with that. And with my personality, I can make the average non-believer uh understand, or at least be a little open-minded. And so that therefore I'm not afraid of lives for that very reason, because I really don't have a problem with talking to people who usually don't know what's going on. Yeah, I'm kind of wrestling with these buttons a little bit, y'all. Yeah, but Janice, I'm gonna say a little role play now. Janice is patient. Right, baby? Right, mommy? Yeah, so she's patient. She ain't complaining. Yeah, getting her all dolled up. Yeah. Let's get this baby all dolled up. Yeah, and I'm loving that big smile, right? Uh Getting back to my psychiatrist, right? Um this psychiatrist that I have, like I said, she's newly appointed because I had a counselor before then, and I had my last session with my counselor about 2 weeks ago, and that counselor, she was very open about me bringing my dolls, and she was like looking forward to it. So she was really kind of sad that I was leaving her, because I really don't want to have a counselor and a psychiatrist, and because I want to get what I need from one person. I don't want to be kind of like competing with me remembering what I talked to one person about and don't want to repeat the same thing. So it's kind of like taking from people. It's not fair, really. If they're there to listen to you and to help you, you want that person to get the full thing that they need to get from you, and vice versa. So she's very understandable. And so I explained to her that my psychiatrist okayed me to bring my dogs, just like I was allowed to bring my dogs to talk to her. So she was very happy to hear that. She's very happy to hear that, because she said, if that's something that works for you, that's something that you like to do. You like to share your dolls in a public setting like that, and I get a lot from preparing my dolls, getting them dressed and combing their hair, and I get I there's a medical term for it. It What I want to just say is it makes me feel good. Give me all kinds of feel good feelings, right? And yeah. It also reminds me of dressing up my children when they were little, and even with my granddaughter. Now she's 6 years old. It's a little bit different with a 6 year old, especially an independent 6 year old. They don't really allow you to pick their outfits out and things like that. And she's one of them. She doesn't, and she hasn't been that way probably since the age of 2. Yeah, 2 years old. She would go in her little closet and do her little finger, and honey, she pick out what she wanted to wear. Maybe it matched, maybe it didn't, but the child picked out what she wanted to wear. So with dolls and small, no, baby, real children, we still have that ability, that freedom, that privilege to pick out their clothes and things like that. And so that's very therapeutic for me, getting back to the word therapeutic, which is something, like I said, some people misunderstand when you tell them that a dog is therapeutic to you. Um, this is how I explain how a dog is therapeutic to me. Everybody is different how they view a dog as being therapeutic. So, coming from my own mouth, my dogs are therapeutic for me because of the things that I do to the dog for myself, that creates those good fuzzy warm feelings, the butterflies in my stomach, because the dogs make me feel good. So there you have it. Yeah, so we are going on with this video. I'm almost towards the end. um I hope I covered um quite a bit. You can let me know in the comments, like, what do you want me to talk about when it comes to mental health? Is it anything in particular that you want to talk about? Just let me know, and next time I'll try to be a little bit more thorough. um it's just so much to talk about when it comes to mental health, that it just depends on what all one person is dealing with when it comes to their own personal mental health. It's a very wide subject. So, with me, just to sum up some of the stuff I talk about when I go see my psychiatrist, without me going too deep, because I'm not going to go too deep. Um, I talk about the loss of my 26-year-old son, of course. Uh, I talk about some things that was kind of traumatic in my childhood that sometimes I still deal with. It could be even triggering in my present relationship sometimes. So I talk about triggers. I talk about traumas. I talk about even problems that I have developed as an adult, like recent years, big major decisions, how those decisions affected me. Not saying that is decisions that I regret. It could be decisions that you stand 10 toes about, but it still can have a sort of negative effect. You know what I'm saying? That maybe it didn't sit well with people that you really care about. But if people take it the total opposite, it can make a decision that you made in good spirits with good intentions feel like something bad, you know? So, I have a professional counselor that kind of helped me through that. That she look cute, y'all. They kind of assure me that it's okay. I'm finna put these cute little lace layered bloomers on the baby now. I got this from Timu, and I got this vintage dress from the thrift store, from the Goodwill store about 2 or 3 years ago. So yeah, and her shoes, y'all, these cute little black shoes came from Timu, and also her long thigh high beautiful bold socks came from Timu. I'm a Timu queen, y'all. Y'all gotta excuse me. So yeah, some of those things I talk about is very heartfelt, and some things are deep, some things is on the surface, but it all affects ourselves in one way or another. It might affect the people in our lives one way or the other, because let's admit we're not in this world alone, and we share this world with people. We share this world with our husbands, our wives. Some people may have a girlfriend or boyfriend. We share this world with our family, our children, our good friends, and things like that. So uh, our mental well-being is so important. So important, y'all. So important. I hope y'all can see her really good. Let me stand up so I see her little feet. This doll is about 24, 26 inches long, and just gorgeous, right? Y'all say hi, Janice. Hi, Janice. Yeah, so I am done dressing her and getting her hair done. And I'm glad that my storage is okay. I'm glad I didn't get cut off. And so I'm very anxious to see if you all are able to hear me in this video. Like I said, I'm working on getting me a mic. I'm working on getting another tripod. So please bear with me. I'm trying to talk as loud as I can. I'm kind of soft spoken to a certain extent. Yeah, so hopefully you all hear me loud and clearly. So I just want to end this video. Hopefully I'm not leaving out anything that you all wish that I would have brought up. And like I said, if I did and it's something else you want to talk about, please let me know in the comments what you want me to talk about the next time we discuss our mental health or our physical health, emotional health. Is all one, okay? Can't we can't eliminate one and say this is better than the other. Everything tie in together, right? If our mental health is together, it makes our physical health a lot better. I noticed that I hurt less in my body when I get things out, when I talk about it, when I don't suppress how I feel. It relieves that tension. It comes off of my nervous system. My food digests a lot better. This irritable bowel syndrome that I was diagnosed with 2 or 3 years ago, um, sometimes it feel like it's controllable. It just depends on how much stress I allow to come into my life without me doing the necessary things I need to do to combat that, right? So sometimes it's what you eat, it's what you drink. I have to lay off of caffeine. I am a caffeine addict. Sometimes I feel like it's impossible for me to leave the caffeine alone entirely, but God gives me strength a lot of the times. And I'm working on it. It's something to grow on every day, y'all. And please, you all do the same thing. I love y'all with the love of Jesus. Have a very blessed Monday. Until next time, say bye, Janice. Bye. Don't forget to like this video, y'all. Subscribe if you haven't subscribed already. Share if you need to share it to other platforms to help other people. I would greatly appreciate it. Also, please hit the notification bell if you have not hit that notification bell. That way you know every time I drop something from my channel, whether it's posts, pictures from my community wall, or videos directly from the channel. I love y'all with the love of Jesus again. Bye bye. Have a good one.